Namaste all. So, as we are learning the diseases through the Ayurveda perspective, let us see the next disease which we have to learn is called as Mukhapaka. Let's see what it is. The disease in which there is formation of blisters or ulcerations in the mouth is called as Mukhapaka. Okay, blisters or ulcerations in the mouth. So, commonly this is called as mouth ulcer. Okay, it is commonly called as mouth ulcer. Mukha paka. Mukha is uh, the mouth, and paka is formation of blisters. Uh, that is mukha paka. Blisters or ulcerations inside the buccal cavity, the mouth cavity. Mostly comes as a secondary symptom, however, sometimes seen as a primary disease or a complication. Okay, mukha paka mostly comes as a secondary disease or a secondary symptom, some or the other primary disease. However, when it comes as a primary disease, that is how it needs special attention or separate attention. Also known as Sarvasar, Sarvasar in few reference books. Sarvasar, the same disease is known as Sarvasar in few reference books. So you should know the name. Uh, so if you come across a disease which says it is Sarvasara, it is nothing but Mukhapaka. So types of Mukhapaka: Vataja type, Pittaja, Kaphaja, Sannipataja, and Raktaja. Five types. Four are Doshaja and one is Raktaja. Let us have a look at the causative factors. Amla, Katu, Lavana, Rasatmak Ahar. Amla, Katu, Lavana. You can see Pitta, aggravating. Rasas, consuming food very hot. So very hot as in hot in temperature. So drinking hot soup or hot food item or eating too hot when the temperature is too hot of the food, that time Mukhapaka can happen. Blistering basically. So blistering can happen through heat, okay, or hot steam. So consuming food very hot can cause blisters in the mouth. Excessive walking or physical exertion. Excessive walking or physical exertion. Irregular or no bowel movement caused by any reason. So, Malavashtamba or irregular bowel habits can cause Mukhapaka. Exposure to heat, sun, consumption of corrosive food substances like tobacco and any other corrosive food item which people are usually addicted to in various parts of the world. So, here usually we find people consuming tobacco, which is very corrosive, and they mix a certain uh, white alkali in that, which is again uh, no, not alkali. It is again a acid, which will cause more corrosion in the mouth. Then stress can uh, induce Mukhapaka. Disturbed or irregular sleep. Disturbed or irregular sleep. So lack of sleep can cause Mukhapaka. So when we study Hetus and you see a patient of Mukhapaka, then you can certainly ask them leading questions about these things. How is your sleeping pattern? Do you eat anything corrosive? How's your food? What kind of food items do you like? Do you eat too dry or too hot? Or now, for example, few people who have short lunch breaks, they whatever is available as food, they buy it from outside, or they have their, with them they would heat it and whatever is the temperature, they quickly eat it because they have less time. So in the attempt of eating or finishing the lunch or the food quickly, they tend to eat hot. So that can cause Mukhopatho also. So understanding the hetus uh, will give us a way of asking leading questions to the patient, because we know, suppose the kind of dosha which is aggravated, then accordingly leading questions can be asked. And by now, I'm sure you all have got a fair idea of what are the causative factors for particular doshas, and when there is aggravation of a particular doshas, what can be the causative factors. Okay, both ways. So this gives us a pathway for asking leading questions while you do the consultation or the case taking, consuming less fluids. So having less fluids will give dryness to the mouth, okay, and can cause ulcerations in the mouth due to excessive dryness also. हेतु सेवन, पित्त प्रकोप, तीक्ष्ण उष्ण गुणात्मक पित्त प्रकोप will be seen, vitiates रक्त धातु, creates blisters inside the mouth, Mukhopatha. So pitta dominant disease in which Tikshna Ushna Gunatmak, the properties of Pitta, Tikshna and Ushna properties of Pitta aggravate. It will further vitiate Rakta Dhatu. We know that Pitta and Rakta are quite closely aligned. Pitta is the mala of Rakta Dhatu. We know that. So Pitta, when it aggravates or gets vitiated, it will cause vitiation of Rakta Dhatu in this case, and the vitiated Rakta Dhatu will cause blisters in the mouth as it finds Kavaigunya in the mouth, and it will get find Sthana Samshraya there, take Sthana Samshraya there, and will form blisters of various types. So we'll see what kind of ulcerations, blisters are seen according to the types. So what is the type of Mukhopatha? Blisters inside the mouth. Blisters are painful. Lips become dry and brownish in color. Lips become dry and brownish in color. Cracks on the tongue because of excessive dryness. Cracks on the tongue. Small outgrowths on the tongue can be seen. Heaviness of the tongue. Because of the dryness, heaviness also might be experienced by the patient. So that heaviness is not due to the heaviness of literal heaviness of the tongue. It is because of the uh, difficulty in moving it because of uh, lack of a water element inside or lack of saliva. So because of the dryness, the movement in the of the tongue becomes difficult. Hence, it would feel heavy. So it is not heavy in the literal sense. It is just because of the difficulty in movement. Intolerance towards cold food and drink. So the patient would feel disturbed when they consume cold food or drink. Overall movement of the mouth for eating, talking becomes troublesome. So because of the dryness one, the blisters second, painful blisters, difficulty in movement, cracks on the tongue. So the overall movement of the mouth and the tongue inside becomes troublesome for the patient. So the patient is not able to talk properly nor eat properly. Okay, so that is Vataja type of Mukhopatha. In Pittaja type of Mukhopatha, blisters appear like burnt lesions. Blisters are there in the mouth, but they look like burnt lesions due to the color. Burning sensation is more. In Vataja, pain is more, here burning is more. Blisters are small in size with red borders. The borders around the lesion, they are around the blisters are red in color. Blisters are red or yellowish in color in the center. Okay, blisters can be red or yellowish in color in the center. So first formation may be seen, or it can be seen as reddish due to the presence of rakta in the center. So imagine a blister filled with pus or uh, rakta or blood. Bitter taste in the mouth. The patient will have a feeling of bitter taste in the mouth in Pittaja type of Mukapaka. What happens in Kaphaja type? Blisters are same color as that of the skin. So they are like colorless blisters. Okay, so you can the patient can feel it. You may not be able to see it very clearly unless you look at them very carefully. Blisters are soft and uh, have sticky secretions inside. Okay, and patients tend to break those blisters, which ideally should not be done, but they tend to break the blisters because they feel that if they are burst open, then it can heal faster. So we have seen patients doing it with the tongue also, with the needle also, the teeth also. So it becomes complicated if it is not well managed. The hygiene is not properly maintained because of lack of awareness, lack of knowledge about the problem, and they tend to take it if it is a small blister or 2 3 are there, then they tend to take it lightly. Okay, they don't take it very seriously. Sweet taste in the mouth, typical of kapha. Blisters are itchy. They can cause itch inside. Pain is less or mild. Okay, so we saw more pain in Vataja, burning sensation in Pitta and Kaphaja, mild pain or very less pain. Okay. Color of the blisters are also different. One is colorless, the other is reddish yellowish, the other one is the blackish color one. So the color and appearance of the blisters also will give you an hint of what type of dosha is vitiated. Okay. Sannipataj, signs and symptoms of all three doshas are seen together. Sannipataj, which is quite self-explanatory. Signs and symptoms are similar to those of Pittaja type. In Raktaja type, signs and symptoms are similar to those of Pittaja type. Additionally, blisters or acne are observed on the body as well, indicating Raktadhatu initiation. So, on the face, also on the back, can be seen acne, wherein the Visheshan of Raktadhatu will be, which will be indicative of Visheshan of Raktadhatu. So, here the purification of Raktadhatu, simultaneously the treatment of Pitsaja type of Mukapaka, both will have to be done simultaneously. So, this will be indicative of Raktaja type of Mukapaka. So, we saw Vataja type, Pittaja type, Kapaja type, Sannipataja and Raktaja type of Mukapaka. See, Mukapaka or mouth ulcers are very common and similar to what we saw during Manyastamba, that patient may come to you, may not come to you. If they are recurrent, then patients may come to you for a better solution. If they are, uh, say for example, Mukapaka can be seen in Malavashtam also, irregular bowel movements also. So in that case, the patient may come to you for Malavashtamba and also say that I get blisters frequently. Okay, and if they are having blisters issue with only blisters, then if it is too frequent, then they may come to you. Okay, now here one more thing is, while you examine these blisters and treat them as Mukapaka, if they are uh, very recurrent and you see damage to the skin to a larger extent, then you should also think of uh, the carcinoma, is squamous cell carcinoma. Then you should be able to refer that patient to uh, a institute where the testing properly can be done, and the treatment uh, can be done if it all uh, it is diagnosed in that manner. So you should not miss this. If you are treating them as Mukapaka, well and good. If they are giving good results, well and good. But if it is recurrent, try to find out the underlying cause. If not, then it is better to also have a referral check with with uh, with a doctor who takes care of the cancer patients. So um, we call it as opinion of the doctor. So we tend to send if we have any kind of query where we feel that opinion of some other doctor is required due to machinery. Now, for example, ENT patient comes to you, a patient who ideally who should be checked by a ENT specialist, and if they come to you for ear pain, you do Karnapuran. It subsides, but it comes back again. So if you do it twice, that treat the patient twice, and but the pain is again coming back, then it is better to take opinion of the ENT specialist also once, so that it does not become wasting of time, because if there is underlying cause to it, it may further progress to the next level. We never know. So it is no harm in taking opinion of a specialist who deals with those kind of patients on a daily basis. Okay, so uh, one eye should be always kept on the extent of uh, damage which the ulcerations are doing, the blisters are doing. Secondly, we also know that patients whose immunity is compromised, okay, in them recurrent mouth infections are seen. So those also have to be ruled out properly. Those also have to be checked properly. Do they have any other signs and symptoms of some other primary disease? So those things also have to be checked. So even if the patient is coming to you for Mukapaka, a proper history of the patient should be taken for other medical illnesses in order to understand that whether this is a primary disease or a secondary symptom of some other primary disease or a complication of some other primary disease. You're getting my point? So even if it is a small thing, because it is quite commonly found, while treating it, you have to be careful about taking the medical history one. If it is a simple type of Mukapaka and it gets treated in one go, it is very good for you and the patient also. But if it is recurrent, then something underlying is happening. Okay, it can be Hetu, it can be other primary disease, etc. So that needs to be found out. If you are able to do it, do it. If not, take opinion of uh, a specialist of that particular part. Here, send it to you. Send it to. If you feel that it is uh, carcinomatous, send it to the cancer specialist. Take their opinion. If they say no, it is not cancer. Okay, fair. Continue the treatment with Mucopac and explain the patient that okay, we are doing it for a referral. Sorry, for a opinion sake, so that we are ruling out, because it is happening recurrently, we are ruling out any other chances so that that disease does not progress to the next level. Now here, because it is carcinoma as your query, you have to take the patient, his family members into confidence and trust first, because it is very critical and it is very sensitive. It is very sensitive because if it is not diagnosed as that, then the patient may feel offended. Hence, you should be able to explain the patient properly why you are taking this opinion of some other specialist. Okay.
Dr.
Prognosis wise, yes,
It's Sonia here.
yes.
Uh, I've just wondering, is it worth sometimes maybe even asking them to have a blood test if it's something simple like, say, a vitamin D deficiency or something, or not really?
See, we can do it. That's what I'm saying. That if you are feeling that it is happening, or if you see that it is happening on a recurrent basis, then you have to rule out the other things. So, what those other things can be? Think aloud. What else can be? So, hence taking the history of, and one thing which I usually always ask the patient is, have you done any blood checkup in the recent past?
Right.
So they would say yes or no. If they've said yes, can we see that those? And in that, you will certainly find some or the other variation in some reading, which may be borderline or just above the border. If they have not performed any blood test, and you feel that it may be due to lack of some other vitamin or mineral or whatever, you can get the tests done accordingly.
Right. Okay. Thank you.
Yes. So prognosis wise, as a primary disease, Mukha Paka is easy to treat, that is Sukha Sadhya. Prognosis as a secondary disease or complication will depend on the severity of the primary cause. We just discussed about it. So if there is a primary cause and if it is serious, like carcinoma, which we said, then the treatment of the primary disease needs to be done before we do this, okay, or simultaneously as we do this, okay. And believe me, you may feel that okay, I have sent my patient to somebody else, but the patient will always give you blessings if they find that something else has is happening and that was diagnosed in time and nobody else could think of it. I mean, they will only give you blessings, and those blessings are worth so many $1 million, okay. And then don't think of business that time, think of the benefit of the patient, okay. Chikitsa, Vataja type of Mukapaka Kavala with sesame oil or Amla Kanji should be done. Triphala plus raisins squat plus ghee. So a quath or decoction of raisins, we know the black raisins and triphala. We do a decoction, bring it to bearable level temperature, add a spoon of ghee with it, and do gargling. Okay, Kavala is gargling with it. Okay, and when we know that if the affected part is again up to the throat region, then you can ask the patient to look up and do the gargling with the sound and throw it out. If it is only related to the mouth region, just mouth rinsing is sufficient. Okay, Triphala has decoction, has a capacity to heal a lot of ulcerations, a lot of wounds, chronic wounds, even diabetic wounds also. Okay, so cleaning with Triphala decoction. Now, if you are doing it for the wounds, then it has to be filtered 7, 8, 9, 10 times so that only water part remains, not the particles come. Because if the particles come, they can get stuck inside the wound and it can further cause any other problem. So, when you are cleaning a wound, make sure that the decoction is filtered multiple times. Jatyadi oil, which is a ready preparation, can be applied with the finger and keep it. So just apply and leave it on. Okay, it can be swallowed also. However, just tell the patient apply it and not to spit out. You can engulf it, it's okay, but uh, keep the oil as much as possible in the mouth. Okay, and tell the patient not to eat or drink anything immediately. So at least 1 hour after the application, just even if there is burning sensation, Pitta will see. Apply ghee, keep it. Keep it for a while. Don't drink or eat anything immediately. Okay? In Vataja type of Mukapaka, Nasya with pacifying oil or sesame oil is good in Vataja type of Mukapaka. Pittaja type Mrudu Virechan, mild Virechan can be given. Gandharva Ritaki can be used for that. Gandusha with sugarcane juice, milk, grape juice. These are very, very good. The patient will like it. Hold it, Gandusha, you know the process. Hold it and then spit it out. Okay, sugarcane juice, milk, grape juice, room temperature. These are all room temperature.
Oh,
Kavala,
sorry, just a question. With the
Yes.
gandusha, you just do either the sugarcane juice or either the milk. You don't mix them together. Fine.
not mixed. There is a comma.
Yes.
So,
Okay. Thanks.
yeah.
Yep.
So either sugarcane juice or milk or grape juice,
Yep.
not together.
Okay. Thanks.
Kavala can be done with Triphala, raisin, squar plus ghee. Similar combination as we saw for Vataja. Similar can be used in Pittaja type of Mukhapaka. As I said, Triphala has the potency and the capacity to heal any type of wounds. So it stays true even here. Milk plus sugar internally, milk plus sugar will pacify Vata, give them internally to drink. Nasya with milk or ghee will room temperature will be good in Pittaja type of Mukhapaka in order to alleviate Pitta. Local application of milk cream. So milk cream is as you boil milk, there is a layer of cream which comes on top. Usually we recommend cow milk and the cream out of it, which is mild yellowish color. So take that and mix it with Kamdudharas. It's a ready preparation. It's a tablet. Mukti cube if you get. If not, the Sadha one also is fine. Make it into a powder, mix it. That paste can be applied on the lesions inside the mouth. Okay, so that can be swallowed also. However, ask the patient to keep it as much as they can. These are very simple remedies which can be given. Mrudu Virechan is good in Pitta.
Hello.
Yes,
And how about Kalais Jivan that we sell here at the center?
how about I could not hear. Can somebody help?
Kailash Jivam.
Kailash Jeevan.
Yeah.
Yes, it can certainly help. It is available there. Oh, yes,
Yes,
it is.
yes,
Kailash
yes.
Jeevan can help. It can help. In
Okay.
Pittaja type, yes, certainly yes.
Thanks, sir. Thank you.
Okay. Kafaja type, local application, Shar or Lavana can be applied in order to alleviate the kapha. So Yavak Shar, if it is available there, then can be applied. Or simple Lavana, so sender also can be applied. Kavala with Triphala plus resin squat. Now in this combination, you can add honey or alkalis like Shar if Yavak Shar is available. If not honey, a spoon of honey in the quath can be mixed and that can be given for the gargling. Okay, and now how many times should the gargling be done? 4-5 times is fine. So a glass of say 200 ml of uh, this mixture, ready mixture, can be given and ask them to take 2 or 3 sips. Continuously rinse it, hold it for a while, spit it out. Next, rinse it, hold it for a while, spit it out. So that it gives time for that preparation or that mixture to work inside the buccal cavity. How many times can be done? It can be done twice, thrice also, depending on what is the extent of problem. So if it is done twice, it is more than sufficient. But if the burning sensation is more, the pain is more, it can be done 3 times also. Khadiradi is a ready preparation which can be given uh, to chew just to keep it in the mouth. Okay, instead of just swallowing it, break it into pieces and keep it in the mouth. It will give wonderful results. Khadiradi Khadiradi is good for issues related to the mouth and the throat. If you remember, we saw Khadiradi in Swara Bheda also. Okay, Swara Bheda. Khadiradi. Khadir is the main ingredient in that particular tablet. Raktaja type of Mukapaka, treatment same as Pittaja type, and Rakta Mokshan additionally will help. Now here, Rakta Mokshana becomes a bit challenging because if you are doing Rakta Mokshana say inside, then you have to be very careful that the leech is stuck there properly and doesn't fall off and go inside. Uh, I mean, we have not really seen any patients like that, but you can keep the patient on one side, keep the mouth open, and keep the leech, and you can tie maybe a thread to loosely to the leech and keep it outside so that you can easily, as it releases after taking the impure blood, it can be easily taken out. Okay, just a hint so that if you are able to do Rakta Mokshan, it releases the pain and the burning sensation uh, very fast, very fast, and heals the wounds very fast. Okay, because the impure blood goes and the pure blood comes flushing in. So then the healing becomes faster. Okay, in diabetic wounds also, we have done leech therapy, works wonderful. Mukha Sannipata treatment as per the signs and symptoms of all the three doshas, the dominant dosha uh, can be treated first, or majorly those medicines can be used as per the dominant dosha. Pathya controlled Madhura. Madhura Rasa can be given controlled, as in should not be consumed in heavy quantity. Madhura Rasa, ghee, raisins, cumin seeds, coriander seeds, fresh coriander, fresh coconut, almonds, dates, milk, butter, all these are pacifying. All these are pacifying. According to the dominant dosha, you can always tell these. Okay. Raktaja Pittaja certainly can work wonders. Few things can work wonder in that. Timely sleep. So go to bed in time. If they wake up early, no problem, but they have to go to bed in time. Sugarcane juice internally is very good. Do not ask the patient to swallow the sugarcane juice used for Kavala Gandusha. Okay. Separate sugarcane juice should be given to consume internally, and it should be better if it is room temperature. Okay, do not add ice into it and ask the patient to consume, or tell the patient specifically so that they don't consume it cold. Any fruit juices for that matter. Best is to eat it as it is. I mean, cut it and eat it. However, sugarcane juice in this case should be consumed in room temperature. Now, pomegranate is pathya in some other disease. So, how should it be consumed? Consume, chew it and swallow it. That is the best way of doing it. Okay, Gulkand is a rose petal jam. Jam? What is it called? Jam. Sonia? Jam, is it?
Yeah,
Rose
yes, you
petal.
can call it a jam.
Yeah, rose petal jam. So that is very good. Huh.
But it
Yes.
is made differently though, of course, isn't
Yeah,
it?
yeah, of course, of course. Just for understanding, I'm saying. Is it available there?
Yes, you can buy it in the Indian shops.
Okay, okay. So Gulkand is very good for Mukha especially Raktaja and Pittaja type of Mukha. Thank you, Sonia, for that. Apathya, exposure to heat, sun, fasting, or untimely food. Untimely food, so people who have Pittaja type of constitution, Pitta Prakriti, and if they do not consume food in time, they can also have Mukapaka, okay, because of the excess of acid in the body, okay, so they can also have Mukapaka. So timely food for Pitta Prakriti patient is important. Katu, Ushna, Tikshna will be Apathya. Staying awake till late night is Apathya. Vidahi, alcohol will be Apathya. Hence, we also do not recommend any kind of Asavarishtas in Mukapaka. So, Yeah, easy to treat, easy to diagnose disease, short disease. Of course, you may find patients who may come with primary disease or as secondary symptoms also. Okay, if there is anything you wish to ask about Mukhapaka, I'm happy to answer. Okay, just a small input. Butter also, cow butter also is good for Mukhapaka. So, when if cream is not available, then unsalted butter, cow butter can also be used for local application. Okay, and Pittaja type and Rattaja type of Mukhapaka. In fact, in Vataja type also, butter, cow butter, unsalted butter will help. Okay, fair. So with this, we complete Mukhapaka. Thank you so much for your patient listening.
Thank you.
Thank you.
Thank you, Dr. Swapnil.
Yes, yes, my pleasure. So stay safe, keep reading, keep enhancing your knowledge, and let us connect again uh, next Wednesday with a new topic and something interesting to learn.